This is All India Radio. We now bring you a special news program on COVID-19. Good morning, I'm Sunil Verma and with me is Subhadra Ramachandran. The headlines. Maharashtra, Telangana and West Bengal announce extension of lockdown till 30th April. Chhattisgarh government makes wearing of masks compulsory at public places. Finance Ministry extends deadline for mandatory minimum deposit in Public Provident Fund PPF and Sukanya Samriddhi account till 30th of June. Telangana government decides to promote all students from class 1 to class 9 due to lockdown. Sri Lanka thanks Prime Minister Narendra Modi for sending medicines to fight COVID-19. Nepal government rules out lifting of lockdown in the Himalayan nation till the situation normalizes in India. Maharashtra, Telangana and West Bengal have decided to extend the lockdown till 30th of April. Maharashtra Chief Minister Uddhav Thackeray has said that the lockdown will be extended in the state till 30th of April. He said he had expressed the willingness to extend the lockdown during video conferencing with Prime Minister Narendra Modi yesterday. Mr. Thackeray warned against complacency in the fight against the virus outbreak. Telangana State Cabinet cleared a proposal to extend the lockdown till 30th April yesterday. Chief Minister K. Chandrasekhar Rao said state border with Maharashtra will be completely sealed. State government has stepped up measures to contain spread of the coronavirus. The number of containment zones in the states have increased to 243, including 123 in Hyderabad and Sikandarabad. With 16 more people testing positive for coronavirus, the total number of COVID-19 cases in Telangana has risen to 503. 2 more people succumbed to COVID-19 yesterday. With this, total deaths reported due to COVID-19 has gone up to 14. 51 people recovered from the disease and were discharged from hospitals. With this, total recoveries reported in the state have also gone up to 96. Over 25,000 people who were under quarantine have also been released.
West Bengal government also announced extension of ongoing lockdown till 30th of this month. State government has also announced suspension of classes in schools, colleges and universities till 10th of June. 6 fresh corona positive cases have been detected in the state during the last 24 hours, taking the total number of patients to 95. Chhattisgarh government has made it mandatory to wear masks at public places. According to the order, it has been made necessary to wear a mask or cover the face with homemade masks before moving out in public places. The state government has said that if anyone comes out without a mask, then legal action can be taken as per the rules of Chhattisgarh Public Health Act or Chhattisgarh Epidemic Disease. In Maharashtra, the number of COVID-19 cases reached 1,761 yesterday, with 187 new patients being detected. A State Health Department statement also said that 17 coronavirus patients died during the day, including 12 in Mumbai. With this, the death toll due to COVID-19 in the state rose to 127. Out of 17 patients who died yesterday, 16 were also suffering from other ailments such as diabetes, high BP, asthma and heart disease. 2 patients also suffered from tuberculosis. As many as 36,771 persons have been tested in the state so far. 208 patients recovered and were discharged from hospitals. In Karnataka, a critical care support team is constituted at the state level to provide medical advice to the treating physicians of all government hospitals in Karnataka. The team of specialist doctors from Rajiv Gandhi University of Health Sciences will every day review COVID-19 patients admitted in ICU with ventilator and oxygen support, cases with comorbidities like hypertension and diabetes mellitus, cases above the age of 60 years and pregnant cases. The team will have 9 or more experts who will work in a shift of 8 hours. They will be connected with identified COVID-19 hospitals through Zoom call. Any treating physician of identified hospitals can contact experts round the clock in case of any emergency. Karnataka government has also launched an insurance cover for the health workers. More from our correspondent.
An insurance cover will be provided to health workers fighting COVID-19 pandemic in the state. The scheme is launched under Pradhan Mantri Garib Kalyan package announced by the central government. This will provide insurance cover of 50 lakh rupees for 90 days to the frontline warriors. Totally 22.12 lakh public health care workers, including Ayush doctors and all community workers who are in direct contact and care of COVID-19 patients and who may be at risk of being impacted by this will get this insurance cover. It provides coverage for accidental loss of life on account of COVID-19 related duty. Sudhindra, AIR News, Bengaluru.
Tamil Nadu has recorded 58 new COVID-19 cases yesterday, taking the total number of infected patients to 969. One person in Erode died of the disease, raising the death toll to 10. In another development, Indian Council for Medical Research has approved one more laboratory to test for novel coronavirus that causes the COVID-19 disease. The lab has been operationalized in the Government Medical College Hospital, Dharmapuri. More from our correspondent.
The pattern of the disease spread in Tamil Nadu is being studied by a state committee of medical experts and epidemiologists. The state chief secretary has said test samples are being collected from all the close contacts of the COVID-19 patients. As the testing progresses further, a comprehensive understanding about the extent and nature of the disease prevalence is expected to be arrived at. 50,000 rapid testing kits are likely to arrive from the center very soon, as said by the chief secretary. Currently, the testing is being undertaken only using the polymerase chain reaction PCR kits that doctors say give a more reliable result, though it takes a bit longer time. Jai Singh, AR News, Chennai.
In Madhya Pradesh, 78 new cases of the COVID-19 infection were reported in a single day in the state. The total number of patients in the state rose to 529 till yesterday. So far, 40 people have died due to infection, while 38 have recovered. The state government has directed to all the banks that they must provide home access service to the public for cash requirement. More from our correspondent.
Following the instructions of the government, payment of social security pension to old, Divyang and helpless people has been started through Bank Mitra and Bank Sakhi in various districts of the state including Ratlam. Rakesh Garg, the manager of Lead Bank in Ratlam, told that this will reduce the congestion.
अभी 400 बैंक में तो है हमारे पास 418 करीब प्रधानमंत्री गरीब कल्याण योजना में जो पैसा पेंशन योजना है प्लस उसके अलावा भी यदि इनके अकाउंट में बैलेंस है हमारे यहाँ बैंक में तो घर घर जाकर इसको पेमेंट करता है.
Common people are also very happy with this efforts of banks. One beneficiary, Mohammad Arif, said,
एक अच्छा कदम है. इससे एक तो क्या होगा कि हमको बैंक जाने की जो असुविधा है वो उससे दूर रहेंगे. दूसरा सोशल डिस्टेंसिंग की जरूरत ही नहीं पड़ेगी अगर हम बैंक नहीं जाएंगे तो.
Apart from more than 9,000 ATMs in the state, 16,700 fixed point kiosks are being operated in rural and suburban areas in the state by the banks for payment. Sanjeev Sharma, AIR News, Bhopal.
Gujarat being the pharmaceutical hub of India, the government is ensuring the sufficient stock of medicine, especially hydroxychloroquine. Talking to AIR News, State Commissioner of Food and Drugs Control Administration, Dr. Hemant Koshia said there are 28 private firms in the state which have the licenses to produce hydroxychloroquine. A report from our correspondent.
Mr. Koshia said there is a sufficient stock of medicines, sanitizers and masks in the state. He said although the pharma companies are facing labor shortage, they are working tirelessly to ensure the mass production of the medicines in the light of COVID-19. So far, there are 268 licensed manufacturers which are active in manufacturing of sanitizers in the state, and the government is still issuing licenses to new players in view of COVID-19. He said the government has held meetings with the stakeholders involved in the mass production of medical equipments, including masks, and assured them all kind of support such as power supply and necessary permissions to ensure the sufficient stock of medical equipment in the state. Aparna Khut, AR News, Ahmedabad.
In Bihar, number of corona positive cases has gone up to 64, with 4 new cases reported yesterday, while 3 fresh cases were reported from Begusarai, 1 is from Nevada. Their contact tracing is being done. 18 persons have so far been cured. 1 person in Munger died of coronavirus.
In Himachal Pradesh, non-governmental organizations and volunteers will team up with the state government to prevent the spread of COVID-19. So far, 55 non-governmental organizations have been registered in every district for activities related to relief, prevention and awareness. On the other hand, Rural Development Department Himachal Pradesh has also come forward to combat COVID-19 by making masks on a war footing with the help of self-help groups to fulfill the state demand. Our correspondent filed this report.
The Himachal Pradesh State Disaster Management Authority is trying to ensure the involvement of non-governmental organizations and volunteers in the prevention of coronavirus epidemic and related relief, rescue and awareness-related activities. In some districts, NGOs have come forward on their own to start an awareness campaign and providing assistance to those who are ultra-vulnerable to COVID-19 infection. On the other hand, to meet the continuous demand of the mask in the wake of COVID-19 pandemic, almost 2,000 women of 250 self-help groups roped in for making masks under National Livelihood Mission. Sanjeev Sundaryal, AIR News, Shimla.
In Ladakh, in view of the forthcoming sowing season, Agriculture Secretary Sogat Biswas reviewed the modalities of distribution of seeds and fertilizers to farmers and desiltation of irrigation canals in the wake of the lockdown. A report.
To ensure non-disruption of agriculture work in the wake of COVID-19 in Ladakh, the Agriculture Secretary has directed the executive engineers of irrigation and flood control in Leh and Kargil district to complete the desiltation of irrigation canals within this week. He also directed them to ensure uninterrupted water supply to the farmers. The seed distribution have already completed for the forthcoming sowing season. The Agriculture Department is also preparing to distribute vegetable seedlings among the farmers through its farm. With Ramesh Chandra, Yangchen Dolma, AIR News from Leh Ladakh.
Centre and state governments are in a continuous combat mode against the novel coronavirus. Areas which are at higher risk of wider spread of infection are earmarked as containment zones to contain any further spread. Delhi added 3 new places yesterday, taking the total tally to 33 of such containment zones in the national capital. Areas around house number A176 Deoli Extension, A30 Mansarovar Garden and street numbers 1 to 10 C Block Jahangirpuri are the newly demarcated containment zones. Government has urged citizens to support the call of no movement in such areas. This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Maharashtra, Telangana and West Bengal announced extension of lockdown till 30th April. Chhattisgarh government makes wearing of masks compulsory at public places. Finance Ministry extends deadline for mandatory minimum deposit in Public Provident Fund (PPF) and Sukanya Samriddhi account till 30th of June. Telangana government decides to promote all students from class 1 to 9 due to lockdown. Sri Lanka thanks Prime Minister Narendra Modi for sending medicines to fight COVID-19. Nepal government rules out lifting of lockdown in the Himalayan nation till the situation normalizes in India. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
A total of 7,529 confirmed cases of novel coronavirus or COVID-19 have been reported in the country so far. Out of these, 652 patients have recovered and discharged from the hospitals, while 242 patients have died. Briefing media in New Delhi yesterday, Joint Secretary, Ministry of Health and Family Welfare, Love Agrawal said, India's response to contain COVID-19 has been proactive and it has followed a graded approach. He said, in coordination with the states, the centre is ensuring supply of PPE and 95 masks, testing kits and ventilators, and dedicating COVID-19 hospitals are also being set up to provide proper treatment. Mr. Agrawal informed that as of now, 586 dedicated COVID-19 hospitals have been set up with a capacity of more than 1 lakh isolation beds and around 11,500 ICU beds.
डेडिकेटेड कोविड हॉस्पिटल्स जिनके द्वारा इन्फेक्शन ना फैले और पेशेंट्स को प्रॉपर ट्रीटमेंट मिल सके, उसको भी स्टेट के साथ मिलकर, सेंट्रल गवर्नमेंट इंस्टीट्यूशंस के साथ मिलकर बनाया जा रहा है। और अब तक की अगर संख्या देखें तो 586 डेडिकेटेड हॉस्पिटल स्टेट ने हमें रिपोर्ट किए हैं, गवर्नमेंट ऑफ इंडिया और स्टेट गवर्नमेंट ने मिलाकर, जिसके द्वारा करीब 1 लाख प्लस बेड्स, आइसोलेशन बेड्स और करीब 11,500 जो उसमें आईसीयू बेड्स भी उन्होंने प्रिपेयर किए हैं।
Mr. Agrawal said Ministry of Ayush has prepared a set of guidelines on respiratory health and ways to boost the immunity.
इसके साथ ही आयुष मंत्रालय ने इम्यूनिटी बूस्टिंग और रेस्पिरेटरी हेल्थ के लिए जो अपनी एक गाइडलाइन जारी की थी, उसके द्वारा उन्होंने फिर कहा है जिले के जितने डीएम्स हैं कि आप जब डिस्ट्रिक्ट का कंटीजेंसी प्लान बनाएं तो उसमें उन गाइडलाइंस को भी शामिल किया जाए। स्टेट्स के साथ कोऑर्डिनेट करते हुए गवर्नमेंट ऑफ इंडिया का मेजर एफर्ट है कि कंटेनमेंट पॉलिसी, कंटेनमेंट एक्शन प्लान, कॉन्टैक्ट ट्रेसिंग और क्लिनिकल मैनेजमेंट पेशेंट का ढंग से किया जाए। और इसी के तहत ही इससे पहले भी एम्स में एक ट्रेनिंग ऑर्गेनाइज की जा चुकी है। एक और सीरीज ऑफ वेबिनार्स जो नर्सेज की ट्रेनिंग के लिए इस वीक हम ऑर्गेनाइज कर रहे हैं।
As per the analysis done on the rate of growth of cases, Mr. Agrawal said that the lockdown and containment measures are important to fight COVID-19. If we had not taken any measures, then we might have had 2 lakh cases at this time.
हमारी ट्विन स्ट्रैटेजी है, एक तरफ हम सोशल डिस्टेंसिंग और लॉकडाउन को प्रमोट करें और दूसरी तरफ उसके साथ ही हम कंटेनमेंट मेजर्स पे भी अपना काम करें। तो उन दोनों मेजर्स को जब हमने 25 मार्च से लेना शुरू किया है तो हम लोगों ने देखा है कि केसेस में काफी कमी महसूस की गई है। तो अगर आप आज के इस एनालिसिस को एक्स्ट्रापोलेट करके समझें तो शायद लॉकडाउन नहीं होता और हम उसी रेट ऑफ ग्रोथ ऑफ केसेस से जूझ रहे होते तो हमारे शायद 45,000 केसेस हुए होते। और इसी तरह से अगर हम कोई भी मेजर न लेते तो शायद हम 2 लाख केसेस आज इस टाइम हम लोग ऑब्जर्व कर चुके होते। लॉकडाउन और कंटेनमेंट मेजर्स बहुत इंपॉर्टेंट है ताकि हम इस बैटल से निपट सकें।
Joint Secretary in the Home Ministry, Punya Salila Srivastav, said that Ministry of Home Affairs has requested the states to provide police security to doctors and other medical staff as needed in the hospitals as well as quarantine facilities where they are working. She said Central Armed Police Forces are also working hard in containing the spread of COVID-19 through improving community awareness, setting up quarantine camps and providing food to stranded workers. She said NCC and NSS cadets and civil defense volunteers have come forward to render their services in fighting. Ms. Srivastav also said that the situation regarding essential supplies and commodities is satisfactory and is monitored at every level.
एसेंशियल कमोडिटीज और सप्लाईज की स्थिति नियंत्रण में है और हर लेवल पर मॉनिटर हो रही है। इस संदर्भ में आपको बताना चाहूंगी कि कई लोग आगे आ रहे हैं। हमारे एनसीसी और एनएसएस के कैडेट्स और सिविल डिफेंस के वॉलंटियर्स भी इस मुहिम में आगे आए हैं। कोविड-19 को फैलने से रोकने के लिए और इसमें अपनी सेवाएं प्रदान करने के लिए हमारे सेंट्रल आर्म्ड पुलिस फोर्सेस यानी कि हमारे केंद्रीय सशस्त्र पुलिस बल भी भरसक प्रयास कर रहे हैं।
ICMR head scientist Dr. Raman Gangakhetkar said that we have tested 1,71,718 samples so far, out of which 16,564 samples were tested on Friday. He said 146 labs are functional under ICMR network, while 67 labs are in private sector. All officers of Joint Secretary level or above will resume duty in their offices from tomorrow. Sources said that the government has asked all the officers who are entitled to official transport to come to office from tomorrow. In our series Experts Speak, we bring you the views of the leading medical experts on COVID-19. Dr. Anant Mohan, head of pulmonary medicine, AIIMS, has advised the people not to take medicines like hydroxychloroquine or anti-malarial without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other anti-malarials without a proper prescription by a doctor. Do not self-medicate.
Dr. Neeraj Nishchal, Associate Professor, AIIMS, suggested to the people to stay at their homes to avoid infection.
This is a new virus, so it has got a very big ego. It will not come to your house unless you go out and invite it. So stay home, stay safe.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Madhur Yadav, Director and Professor in Medicine at Lady Hardinge Medical College, New Delhi, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website, newsonair.com, and on our YouTube channel, News on AIR Official. You can also follow us on the News on AIR app for updates. Finance Ministry has extended the deadline for mandatory minimum deposit in Public Provident Fund PPF and Sukanya Samriddhi account SSA for 2019-20 by 3 months up to June 30th in view of the lockdown due to the pandemic. The Finance Ministry in a tweet said that relaxation will be applicable for account holders of PPF, Sukanya Samriddhi account SSA and recurring deposits RDs. Government has taken the decision to safeguard interests of small savings depositors in view of the lockdown. To keep these accounts active, the subscribers are required to make some specified deposit in a year, otherwise penalties charged over that. The Finance Ministry said the subscribers of PPF and SSA may now deposit their savings up to June 30th, which couldn't be deposited in 2019-20 due to lockdown in the country. An office memorandum issued by the Finance Ministry also said that the account holders of the specified schemes will be eligible to make a single deposit each in the account or accounts opened in his own name or the name of minors. Life Insurance Corporation LIC has announced an extension of 30 days for payment of premium due in March and April 2020 to mitigate the hardships being faced by policyholders in the wake of COVID-19. LIC said that relaxation is allowed up to April 15th for February premiums, where grace period was expiring after March 22nd. It also said that policyholders can pay premiums through LIC's digital payment options without any service charge. Premiums can also be paid by downloading mobile app LIC Pay Direct.
Commerce Ministry has taken several measures to address hardships faced by exporters due to COVID-19 pandemic. The ministry said that it has provided several relaxation and extension of various compliance deadlines to address the hardships faced by the exporters due to the pandemic. The steps include extensions of foreign trade policy by 1 year, export obligation under advance authorization and export promotion capital goods scheme, among others. The ministry said that steps have also been taken to facilitate units in special economic zones. For these zones, extensions have been given, filing quarterly progress report, annual performance reports, and permission to take desktop or laptop outside SEZs by IT and non-IT units. The Tribal Cooperative Marketing Development Federation of India, TriFed, which functions under Ministry of Tribal Affairs, has asked the state nodal departments and implementing agencies to initiate procurement of minor forest producers at minimum support price MSP from the available funds under MSP for MFP scheme. In a letter to Chief Secretaries, state nodal departments and implementing agencies, the Managing Director of TriFed, Praveer Krishna, said that TriFed, in collaboration with UNICEF, is hosting webinar sessions for the Vandhan self-help group members of the Vandhan Vikas Kendras. He said its objective is to create awareness among the tribal gatherers for following social distancing measures and maintaining necessary hygiene required for carrying out their operations.
Telangana government has decided to promote all students from class 1 to 9 of all public and private schools without exams due to the lockdown. This was decided at a cabinet meeting in Hyderabad yesterday. Chief Minister K. Chandrasekhar Rao said parents of students from class 1 to 9 need not worry about exams of their children as they will be promoted to the next class. The Chief Minister also said that farming and related activities will be allowed to continue during the course of the lockdown. He also urged all religious leaders to avoid mass gatherings during the lockdown and appealed to the people to cooperate by staying inside their houses. Union Human Resource Development Minister Ramesh Pokhriyal Nishank has advised the heads of all academic institutions to make optimum use of digital platforms with the objective of making fruitful usage of time of children and keeping abreast with the academic calendar. He said that the HRD Ministry is committed to ensure safety and academic welfare of students. Accordingly, Kendriya Vidyalaya Sangathan, Regional Office Delhi Region, took the initiative of creating IDs on Facebook and YouTube to begin online classes in all subjects for the students of class 6 to 12. While online live classes for classes 6 to 8 will start from Monday, KVS Delhi Region has already started the online live classes for 9 to 12 on Facebook and YouTube.
In the present scenario of COVID-19, to safeguard the healthcare workers, paramedics, hygiene workers and others is the most challenging task. As compared to the increasing positive cases, there is a huge demand of personal protective equipment PPE kits. In Nagpur, Union Minister Nitin Gadkari has taken an initiative of distributing PPE kits manufactured by MSME. More from our correspondent.
Union Minister for Micro, Small, Medium Enterprises Nitin Gadkari has taken an initiative to provide 15,000 personal protective equipment kits free of cost to healthcare workers of government hospitals and decided to get these kits manufactured from MSMEs in Nagpur. He yesterday distributed PPE kits manufactured by the Garment Common Facility Center of Micro, Small, Medium Enterprises to the Deans of Government Medical College and Indira Gandhi Government Medical College at Nagpur. The official of MSME Development Institute Nagpur conducted meeting with the Common Facility Center Orange City Garment Cluster. Dhananjay Wankhede for AR News Nagpur.
Nepal's Prime Minister KP Sharma Oli has ruled out lifting lockdown in the Himalayan nation till the situation normalizes in India. In a video conference with chief ministers of all 7 provinces, Prime Minister Oli said Nepalese government cannot lift lockdown as COVID-19 cases continued to rise in India. He said the government will have to adopt stricter measures to control the spread of COVID-19. He stressed the need to step up coordination between the federal government and provincial governments and appealed to chief ministers to launch awareness campaign on COVID-19. Nepal has so far reported 9 confirmed cases of COVID-19, out of which 8 are undergoing treatment, while 1 person has recovered.
Sri Lankan government has thanked Prime Minister Narendra Modi for sending essential medicines to fight COVID-19. Sri Lankan Foreign Minister Dinesh Gunawardena said his government expressed its highest appreciation and gratitude to PM Modi and Indian government for sending medicines and associated items through a special flight. A report.
Sri Lankan minister said that President Gotabaya Rajapaksa and Prime Minister Mahinda Rajapaksa had made the request for essential medicines and they are happy that Indian government made the supply. Sri Lanka and Maldives are on list of first 13 countries who have been sanctioned to receive hydrochloroquine tablets from India. Sri Lanka will receive 10 lakh tablets in second consignment, while Maldives will receive 2 lakh tablets, considered useful in fight against COVID crisis. Maldives Foreign Minister Abdullah Shahid also thanked the Indian government and PM Modi, saying a friend in need is truly friend indeed. Indian government has earlier sent a team of medical experts and essential medicines which helped Maldives prevent COVID outbreak. Santosh Kumar for AIR News from Colombo.
Indian Railways has identified 67 routes for parcel special trains since the beginning of the lockdown to supply perishable commodities, including fruits, vegetables, milk and dairy products, and seeds. So far, 62 routes have been notified and 171 timetabled trains are being run on these routes. More from our correspondent.
The parcel special trains have been planned to connect all the major cities of Delhi, Mumbai, Kolkata, Chennai, Hyderabad and Bengaluru. Besides, proper connectivity has also been ensured to Guwahati to ensure supplies in the northeastern region of the country. Other important cities connected by these trains include Bhopal, Dehradun, Varanasi, Ahmedabad, Ranchi, Raipur, Patna, Kanpur and Jabalpur among others. These trains are being run even on those routes where demand is less so that no part of the country remains unconnected. Such trains have been given en route stoppage at all feasible locations so that maximum possible clearance of parcels can be done. All the state mission directors and concerned secretaries were requested to mobilize all their resources to take advantage of these trends. Anand Kumar, AIR News, Delhi.
And now an overview of today's newspapers covering COVID-19 stories. The discussion in a video conference between Prime Minister Modi and Chief Ministers to extend the lockdown is the top story in most dailies. Jahan B says PM, Modi CMs on same page on lockdown extension for 2 more weeks with leeway for migrants, farm workers, daily wages, reports Sunday Pioneer. States want up to 10 trillion rupee package, headlines the Sunday Business Standard. In a box item, Hindustan Times reports that union ministers and senior government officials will be back in office from Monday as a step towards resumption of normalcy. In a first, Health Ministry reports 1,000 new cases in a day is the headline in the Times of India. The Hindu reports of migrant workers' protest turning violent in Surat, while the Times of India reports that 3 night shelters in Delhi were set ablaze over food distribution. The government plans to increase daily testing from about 15,000 a day to 1 lakh by 31st May, writes the Sunday Express. Finally, the Sunday Statesman report that crime around the world has dropped as COVID-19 keeps people inside.
And now, before we end the special news program on COVID-19, the headlines once again. Maharashtra, Telangana and West Bengal announce extension of lockdown till 30th of April. Chhattisgarh government makes wearing of masks compulsory at public places. Finance Ministry extends deadline for mandatory minimum deposit in Public Provident Fund (PPF) and Sukanya Samriddhi account till 30th of June. Telangana government decides to promote all students from class 1 to 9 due to lockdown. Sri Lanka thanks Prime Minister Narendra Modi for sending medicines to fight COVID-19. Nepal government rules out lifting of lockdown in the Himalayan nation till the situation normalizes in India. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. With that, we end the special news program and COVID-19.